that how that works, Steph? Yeah. No?
Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. As well, joining us on the line is the CEO of the Saskatchewan Health Authority, Scott Livingston. Both Premier Moe and Dr. Shahab will have opening remarks, followed by time for questions.
Good afternoon, everyone, and thank you for joining us here today. Saskatchewan's vaccine delivery program continues to lead the nation. That's thanks to the great work of our frontline healthcare workers. Now, nearly 94,000 COVID-19 vaccines have been administered in Saskatchewan. And as of this morning, nearly 100% of the doses that we have received have been administered, well ahead of any other province. Saskatchewan has now administered nearly 8,000 shots per 100,000 people. That's the second highest of any province and 20% above the national average of 6,600 shots per 100,000 people. Most importantly, vaccines are being delivered first to those that are most at risk of severe outcomes in our province, and that is our elderly, our seniors. We now have virtually completed all first doses in all of our long-term care and personal care homes in Saskatchewan. It's about 56% of those residents have now received their second dose as well, and would be considered fully vaccinated. About 37% of all Saskatchewan seniors over the age of 80 have now received their first dose as well. Late last week, we received an updated vaccine distribution schedule from the federal government, which included a significant increase in the Pfizer doses over the next few weeks. Between Pfizer, Moderna, and AstraZeneca we now expect to receive about 124,000 more doses by the end of March. That's more doses in the next 3 weeks than we have received in the first 3 months of our vaccinations. Now that we are delaying the second dose to ensure that everyone can get their first dose more quickly, that also means that we should be done phase 1 and ready to start phase 2 early in April. This will be a very important milestone because it will mean everyone age 70 and above will have had their chance to get their first shot by early in April. This should significantly reduce the number of serious cases as well as hospitalizations that we've seen. Based on the number of vaccines we now expect to receive, we should be able to begin vaccinating people in their 60s by April the 5th, people in their 50s by April the 19th, people in their 40s by May the 10th, people in their 30s by May the 31st, and all other adults we should be able to start vaccinating everyone else by June the 14th. As you know, because of the limited vaccine supply, we have been calling out to make appointments for people in the early stages of phase 1. Now that the vaccine supply is significantly increasing, we will soon be launching a new website and a toll-free number. This will allow Saskatchewan residents to book your own appointment online or over the phone when appointments open up to your age group, when it is your turn. This is the most important thing that we can do to protect ourselves and to protect those around us, is to make this appointment, particularly in light of the increased presence of variants in Saskatchewan, which Dr. Shahab, I know, will have some comments around and be addressing in his remarks. So when it's your turn, I urge you to make an appointment and get the shot. It's the best thing that you can do to protect yourself, protect others, and protect those in your community. And it's the best thing that you can do to ensure that our life here in Saskatchewan can get back to normal and get back to normal quickly. You will hear more about the new appointment booking system later this week. We have also just received our first batch of 15,500 AstraZeneca vaccines. And as you know, we'll be giving this vaccine to people under the age of 65. Because of the higher case numbers that we have in Regina, we will be opening up the drive-through location in Regina for people aged 60 to 64, and on a priority health and also to priority healthcare workers to receive the AstraZeneca vaccine, and this will happen in the next number of days. We're still determining the exact date, but it will happen as soon as we are able. The drive-through clinics are not by appointment, but they will be on a first-come, first-served basis. Today, our 7-day average for new cases is 141. That's the lowest level in nearly 4 months, and that's down 60% from the peak that we experienced in January. Hospitalizations remain stable at 139. With our vaccination program picking up steam and our case numbers and our hospitalization numbers continuing to stabilize, we can begin to cautiously relax some of the public health orders that we have in place. So today, I'm very pleased to announce that effective immediately, you can expand your household bubble to include up to 3 households and up to a total of 10 people. Now, folks, we still need to be very careful. The fact remains that the more close contacts each of us has, the more chance we have of contracting and spreading COVID-19. That's why we should keep our contacts to those same 3 households. You shouldn't be visiting with 2 households in one evening, one night, and then 2 different households the next night. If you're an elderly person, you may still want to limit your household visits for just a bit longer until you receive your first shot. And I know we're all looking forward to getting together with friends and family, but we still all need to be very careful and to continue to follow all of the practices that have been put in place and recommended by Dr. Shahab that have protected Saskatchewan people so far. We're also changing restrictions on places of worship. Effective on March the 19th, all places of worship can have attendance of up to 150 people total, or 30% of the seating capacity, whichever is less. And seating must still allow for proper physical distancing between households. Most Saskatchewan businesses are open and operating safely under the current public health orders that we have had in place for some time. Those public health orders will remain in place for the time being. But our goal is to remove some restrictions on businesses in the coming weeks as more people continue to get vaccinated. And I've also heard from many people asking about sports and recreational activities, in particular how they pertain to youth. While we have no target date just yet, work is actively underway with our organizations and associations who operate seasonal activities, sports and recreational activities in our communities so that they can prepare for their spring seasons and the potential of programming. We'll be working with our partners in these sectors to ensure their spring and summer seasons are up and running as normal as possible, but also up and running as safely as possible. As Saskatchewan continues to see our case rates and hospitalization rates stabilize, and as we increase the pace of our vaccinations greatly and will in the weeks ahead, we will be actively looking at loosening restrictions in these areas as well as some others in the next number of weeks. We all want life to return to normal as quickly as possible, but we still have to proceed with caution for a few more weeks until more of us have had a chance to get vaccinated. 1 year ago this week, the first case of COVID-19 was detected in Saskatchewan. This has been a difficult year for everyone, I understand. It's been especially difficult for families and friends of the 400 Saskatchewan residents who we have lost due to COVID. And I once again would like to express my deepest condolences to all. But in one of the worst years imaginable, we've also seen the very best of our province, and we've seen the very best from the people that live in our province. Everyone has made sacrifices. Everyone has made sacrifices. Everyone has changed their entire way of life to protect not only themselves, but to protect those around them. We have asked so very much of you, and I want to once again thank all Saskatchewan people for everything that you have done. I know none of us wanted to be talking about COVID yet today when this began about a year ago, but we are in a much better position today than we were a year ago. A year ago, we didn't know a whole lot about this virus. There was no vaccine, for instance. The only thing we really knew for sure was that things were going to get worse in the weeks ahead. And today, 1 year later, we know a lot more about this virus, and we know a lot more about how to protect ourselves and those around us. There are now, for example, several effective vaccines that are approved for use here in Canada and available in Saskatchewan. And they are being delivered swiftly, safely, and very efficiently here in our province. And we know today, relative to 1 year ago, that in the days ahead, things are going to get better. 1 year ago, we were on our way into COVID, and today we are most certainly on our way out. The path out of COVID depends on everyone getting vaccinated when it's your turn. I know that we have asked a lot of everyone over the past 12 months, but we need you to keep doing what you're doing. We need you to keep doing your part to protect yourself and your family members in the weeks ahead. So please, don't stop now. Keep following all of the public health orders and the guidelines for just a little while longer. And most importantly, I ask you, when it's your turn, take the shot. Get vaccinated. Dr. Shahab?
Thank you, Premier. So just a few additional remarks, just reinforcing what the Premier has said. So obviously, I'd like to start by offering my condolences to family and friends of the 9 Saskatchewan residents who have passed away due to COVID-19 since last Thursday, which also unfortunately includes a person under 19 years of age. And this again is a reminder that while serious outcomes, including hospitalization and death, are less common in those who are young, they can still happen. Having said that, obviously, like the Premier said, there's a growing optimism on our accelerated vaccine delivery schedule, and the fact that, increasingly large proportion of the Saskatchewan population will start getting vaccinated over the next coming weeks and months. The weather again is improving. Today is a bit unusual, but again it just supports that we can do so much and continue to do so much outdoors. And even with this announcement of the ability for us to gather 3 households up to 10 people, doing as much as possible outdoors with people who are not in our household, I think is going to remain key to keep our case numbers down. And again, both my federal counterpart, Dr. Tam, and my provincial counterparts, we've all been expressing the same sentiments that the Premier expressed, that it's 1 year since the pandemic started. We do see a light at the end of the tunnel. It's just a matter of few weeks before all of us will get vaccinated, 18 and older. But we do need to stay the course as much as possible to keep our overall numbers down till all of us are vaccinated. While approved vaccines are preventing the most serious outcomes, we have to remember that it takes up to 3 weeks for protection to mount. So even as our most vulnerable are getting vaccinated, it's important that we understand that it will take up to 3 weeks for them to get some level of protection. And especially for those waiting to be vaccinated, we need to continue to, shield people who are more vulnerable as much as possible over the next weeks and months. We are actually watching not just our total case numbers, and they have been coming down, as well as test positive rate, along with some provincial variations. But, we'll continue to watch very closely any fluctuations in case numbers. For several weeks now, we've been seeing a bit of a concern in Regina. And as variants of concern testing expands, we'll continue to see more and more isolates of variants of concern throughout Saskatchewan. But right now, most of the isolates are from Regina. Part of it is, that Regina has more cases, but because of outbreaks and other triggers that result in focused testing for variants of concern, we're also finding more variants of concern in Regina. But that certainly doesn't mean that they are only in Regina. In fact, when we look at overall variants of concern in Saskatchewan, we have now 38 B117, which was first found in the UK, out of which 36 are in the Regina zone, 1 in the northwest, 1 in the Saskatoon, and the initial 3 were travel-related in January, end of January, and the rest are sporadic. Some may have links to interprovincial travel. So again, a reminder that many other provinces have much higher numbers of variants of concern. And we need to be especially mindful of not just international travel, but interprovincial travel. Get tested when you come back. Monitor yourself closely. Spring break is coming again. Recommendation for April break, Easter break is, stay home, to stay close to home as much as possible. Enjoy the Saskatchewan outdoors close to home for Easter break as well. And then we also have 6 B1351 variants, which is first identified in South Africa, 5 in the North Central zone, and 1 in South Central. So again, our picture of variants of concern is expanding as we initially used to send up to 120 samples a week to NML, and those are the results we sometimes get back as a batch. Now, Roy Romanov Provincial Lab is doing up to 190 tests in-house for whole genome sequencing. They're also now starting something called a SNP assay, which screens all COVID samples coming to RPL initially, and then those who screen positive are sent for whole genome sequencing. So this will increase our identification of variants of concern because of more enhanced capacity for both screening through SNP assay and testing for whole genome sequencing, both in-house and in NML. So we will see more isolations, and that helps us to track, variants of concern and modify our public health response. But we have to remember that, prevention is the best approach, where we practice everything we've been practicing consistently over the next weeks to months till, our vaccination rates come up to a high enough level to afford community protection, which we may see towards the end of June, early July, by which time second doses will already have started. And also, when we are symptomatic, we stay home, seek testing, because we continue to see outbreaks in places of worship and workplaces where people who are symptomatic decided to go ahead and go to work or go to a social setting, and then transmission happened. And in retrospect, it was just a scratch in the throat, just a headache. But we need to take all these symptoms very seriously. And at the first sign of not feeling yourself, stay home, seek testing. I think that is going to be critical over the next few weeks and months.
Thank you, Premier Moe and Dr. Shahab. I'll take questions and start in the room. Arthur?
I take the point about declining case numbers and declining hospitalizations, but it seems as though the province is more at risk of having variants take hold than at any time so far this year. And I'm just wondering how both of you can justify loosening restrictions for the first time in, I think, 3 months, just at the time when those variants are putting the province at risk of a third wave.
So maybe I can answer some initial comments. So, the fact that you could not meet anyone outside your household was quite a significant measure that was taken mid-December. And obviously it was very hard over the holidays. And, we stayed that course because our numbers were high over December, then they came down, then they went up quite high in the early part of January. On a positive note, they have been coming consistently down. And all the indicators are pointing downwards. Overall, cases per 7-day average, test positivity, and especially the South Rural, extremely low, Saskatoon doing well, North and far North coming down. Regina, it's true that for the last few days there's been a bit of a increase in cases, and some of the increases through active case finding and outbreaks linked to daycares and workplaces. And then a week or two later you get batch results like we did last evening about variants of concern. So we're looking at all of that, and what it means is that obviously we think it's safe to cautiously allow people to meet between households. But again, I would say for the most part, don't change what you're doing. If you are meeting people from not in your household, meet outdoors. But if you do have to support a family member who you are not meeting because you were restricted by the public health order, because we always had exceptions for single persons, but do so cautiously. Whenever you're indoors, especially with people who may be at higher risk, do your best to shield them in an indoor setting, because I think that's going to be critical for the next weeks or months. The last thing we need is for our friends or relatives who are at higher risk to get COVID before they get vaccinated. And then places of worship again, at some point, it is important to reopen when it's safe to do so. With Easter coming, I think that's important for many people for Easter services. But again, the ROSC guidelines are pretty consistent in terms of all the cautions that should be followed, maintaining the 2-meter physical distance in a large space with good ventilation, mask use, other measures. So we hope that, as long as we all follow those measures, we can keep our case numbers low. But absolutely, while there's so much positivity with increasing vaccination rates and increasing immunity, the variants of concern are, they're through Iran, they disrupted the plans in the UK, where just as vaccination was started, they saw the third wave. And we all need to be very careful in North America and in Saskatchewan and locally in terms of if our case numbers trend upwards, we need to watch that very closely. And then while at this point we have these measures that have been relaxed, I think if case numbers keep trending upward in any local area, some of these things could potentially we have to be reconsidered.
Follow up?
First of all,
I can answer that if you like, or not, if you've heard enough from me. It's a, I would just reiterate what Dr. Shahab has said with respect to variants, and I would just begin by, saying we're fortunate that we can test a larger number of variants within the province at our provincial lab, and that ensures that, we can, identify these variants as they are, present here in Saskatchewan. All the while, over the last number of weeks, while these variants have become present in Saskatchewan and are increasing in their rate, our overall numbers continue to decline. This isn't unlike other provinces. I think there was between 10 and 15 variants of concern reported in Manitoba, 30 to 40 a day in Alberta. I think Ontario is about 30% of their variants of their total cases are variants. So the way to approach the variants is exactly the same way to approach the COVID-19 virus. Is with proper health measures that are in place, and although we are softening a couple of those health measures today with respect to worship services and household gatherings, there's still a significant amount of measures that are in place in both of those instances, as well as the measures remain at this time in place across the broader aspects of our community and our places of business right across the province. We have today an additional tool that we have not had in the weeks and months over the course of the past year, and that is not only access to vaccines, but if you look ahead at the next 2 to 3 weeks, we have more vaccines going to be arriving in the province than what we have had yet. So this is a turning point, and this is a good day for Saskatchewan and a good day for Saskatchewan people. Due to the fact that we will have access to a much larger number of vaccines in the days and weeks ahead. And we have a very robust plan to ensure that we're able to get those vaccines into Saskatchewan people's arms as quickly as possible. That has been showed or been on full display thus far as we have one of the most robust vaccination plans in effect here today. We also now, with given the information that we have about the virus, where it is, the location of many of the variants being right here in Regina, we have the ability now with those vaccines to target them, like we have in the earlier days, in targeting some of our higher case number areas of the province with the early stages of our vaccine rollout. We're able to, in the next number of days, deploy not only the 3,500 Pfizer vaccines that have arrived or are arriving this week in Regina, to Regina people, but then deploy the additional 15,500 vaccines that are arriving or have arrived today or tomorrow to get those out to Regina people as quickly as possible in very, very short order over the next number of days through a drive-through clinic. So this goes back to my original statement. We know much more about this virus. We know much. We have tools that we didn't have in the early days. And this is a good day for Saskatchewan. A year ago, we were going into COVID. Today, we're coming out of COVID. We most certainly, are the days ahead today relative to a year ago. The days ahead, look much brighter than they most certainly did 12 months ago.
Follow up, Arthur?
This is for Dr. Shahab. So these 190 samples that were sequenced at our RPL, that's a fairly small batch compared to the total number of cases province-wide, and yet it's a fairly high share of those samples that were found to have variants. What does that tell you about how prevalent B1117 might actually be in the province?
So we have to remember that the initial sampling was not random sampling. It was anyone who's traveled, anyone who's part of an outbreak, anyone who's under 50 in hospital, and any other concerns, and a bit of random sampling. So it was a bit of oversampling. But I think, as we speak, starting this week, all samples coming to Royal Roundup Provincial Lab will be screened for SNP testing. So that will give us a better picture of, what percentage of total samples, at least those coming here, are potentially variants of concern. And as we said, some provinces are as high as 30%. So they're gradually becoming the predominant strain, as happened in the UK. Some are at 10%. I expect we would be around that 5% mark. But we will see, and this will evolve both over time, and this will evolve geographically. But I think it's important that we keep our overall case numbers low. That's very important. But also we try as much as possible to delay the variants of concern becoming the predominant strain.
We'll take our next question on the line. Operator?
We have Lisa Schick with CJME.
Hi. I guess just coming off what you just said, Dr. Shahab, we need to try as much as possible to delay the variants of concern from becoming the predominant strain. Doesn't that almost go directly against opening up, I guess, loosening some of these restrictions, allowing people to gather in households, which you have said in the past, there's a high degree of danger of people passing the virus to each other in that setting?
Yeah, so the variants of concern have been shown to be 50 to 70% more transmissible, and that reinforces the fact that at a basic level, the same measures are as effective against any variants of concern. 2-meter plus physical distancing, mask use, hand hygiene, staying home when you're sick, those measures work equally well. But you're absolutely right that when we don't follow the guidelines, whether it's at home, at work, at school, at a place of worship, then the risk of transmission goes up by a factor of 1.5 or 2 times. So where you could have an outbreak of 30 people, you could now get an outbreak of 60. So that is a real concern, and that's why it's critical that we really, not just in some of the relaxation measures that are happening, but in our general day-to-day activities, going to school or work, we really double down on all those measures, staying home if you're sick and getting tested, really being very good about mask use. It's paradoxical that immunization rates are coming up, cases are coming down. Exactly the time which we can't let our guard down for the next 2 to 3 months. Pay special attention to our mask use. Use the best mask you have, 3-layer polypropylene filter, or the best reusable mask you have, fit it snugly around your face. The air should be going in and out from the front of the mask, not leaking from the sides. Those little things I think we need to pay more attention to than ever before. And then, as the Premier said, the vaccines are coming fast and furious, and we have to be ready to get them as soon as they come. We should really make the system run out of vaccine before the next batch arrives. I think that is going to be another critical key for us to gradually start emerging out of this much earlier than we thought. Instead of September, our way out is coming as early as June. Everyone 18 and older getting first dose, and second dose is already starting in June.
Follow-up, Lisa?
Yes, you say we can't let our guard down, but isn't that exactly what's being done with loosening these restrictions?
I think the household gathering, that had been a long-standing kind of issue, that it was very hard in some circumstances for people to feel comfortable to provide that support as one family to another family that's close to them, because they weren't a single person, and this really allows for that social support, but it has to be done in as safe a manner as possible. And certainly for those persons who don't need that right now, this is not the time to start having your bubble expand. I think many people have been doing well, shielding themselves, especially those who are 50 and older, and friends, family have been supporting them, in a safe manner. I think that should really be the mainstay. But in situations where there was some need to provide a more consistent social support, I think this allows for that. But at the same time, again, outdoors is much better than indoors. You really can't have a space interaction with people outside your household when you're in your house. You can have someone coming in to assist with an issue, and everyone's wearing a mask, and you increase the ventilation, you open a window if it's warm enough, and so on and so forth. But you can't really socially interact in a safe manner indoors, even within your bubble. And I think we just need to be very careful and conscious of that. But this does allow that ability to support, individuals or families who may be needing that additional support. But again, I think for most of us, we should not change anything. And if anything, actually, we should pay more attention, because of variants of concern, to our consistent best practices, especially, appropriate mask use.
I just add to that, Lisa. As Dr. Shahab said, this is a very important time and a critical time for us actually to just ensure we don't let our guard down, ensure we are following all of the guidelines that are in place. This is a cautious approach, but it's also an approach that I feel shows that we respect and trust the people of the province, that they are going to make decisions that are in the best interest of not only them but their family as well as we go through the next number of days and weeks. As we get into a time where vaccines are far more accessible than they ultimately have been to this point. There may be a case where we have, in a community, for example, one set of grandparents that has been vaccinated and potentially another set that may not be vaccinated yet at this point in time. However, they will be in the next number of days or the next couple of weeks, because we will be to 60 to 69-year-olds by April the 5th. Their time is coming very soon. So they may choose, those two couples may choose to act a little bit differently to ensure that they are protecting themselves, or those families may choose to have access in a little bit of a different fashion over the next number of weeks, just to ensure that we do remain safe through this very critical period of time in the next few weeks. That being said, as I said earlier, we are receiving more vaccines in the next 3 weeks than we have in the last 3 months, and these are going to be made available immediately to the people of this province, and they are going to provide a much greater added level of safety to the people of the province. And we're prioritizing that vaccine plan on one, capacity to ensure that as we receive it, it's made available, but two, we're providing it to the elderly in our communities, because they are ultimately the ones that may experience the most severe health outcomes should they contract COVID. That plan and priority is proving to work in other areas of the world, in other areas of North America, and we are making these vaccines available to Saskatchewan people as quickly as we receive them, and on to some degree a geography prioritized basis. As I mentioned, we're making a number of vaccines available in Regina as early as this week to ensure that we are addressing the presence of the variants in the city of Regina.
We'll take another question in the room. Mark?
Does the province plan on doing more sequencing of the tests here in Regina to find out how prevalent the variant is? And how does the variant affect the R0 number for moving forward?
Yeah, so in early January, we could send up to 120 tests a week to NML. Now the RPL can do additional 192 whole genome sequences in-house. And as of this week, RPL is going to start screening all samples with the SNP assay. So, and they can do up to 3, I'm not sure about the exact number, but certainly the daily case numbers now allow for universal screening. So I think instead of selective sampling, there'll be universal screening starting. So this will get us a better idea of the prevalence of variants throughout Saskatchewan. Because right now there's a bit of oversampling in Regina because there were more cases, and whenever there's an outbreak, there's additional sampling. You test everyone who may have been exposed. The R0, obviously, we monitor the over 7-day case average coming down, but not coming down in Regina. We monitor the test positivity coming down, but less than 5 in many places, but still 15 in Regina. But then we also monitor, the doubling time, or the R0, and the R0 did come as low as 0.5 2 to 3 weeks ago. It's trended up to more than 1 in the last week or two. It's 1.2, 1.3, so that is concerning. It's probably being pulled up by Regina, and we saw that in the past when there were outbreaks in the northwest and in the southwest, the R0 for the whole province will get pulled up. So obviously we're monitoring that very closely, and if we continue to see signals of concern, we'll have to take, especially locally, more significant steps. Right now, of course, the mainstay is, isolate as a case. All your contacts should isolate. And we should know all our contacts, keep a number of contacts low. If there's an outbreak, quick investigation and follow-up of all cases through testing and isolation. But certainly if case numbers continue to trend up, and indications from UK and other countries suggested that variants of concern seem to be a bit more transmissible. And so we're looking at that very closely, that are we seeing in our current outbreaks that may be linked to variants of concern, are they more transmissible? But sometimes it's hard to pin that out. I mean, for the most part, if you have a lot of people in a room where you can't physically distance and there's no mask use, you see more transmission. But I think that those are things we'll continue to monitor very closely, and the increased capacity of RFPL will allow us to, for the most part, check almost all samples for variants of concern.
Follow up?
Yes, with the first death in the under 19 and under age group, how concerned is that? And with the restrictions being loosened, is there a fear that that may lead to more cases and maybe more deaths in that age group?
Yeah, I think that's a really important point. That while the proportion of deaths in young people, are very low, we have to be conscious of the fact that they do happen. Death at any age is a tragedy for friends and family, and it's especially painful if it's a child. And but I think that is something we need to be aware of. And even if you are young, we can't dismiss COVID. And that's why it's very important for even for all of us 18 and older to already have in our mind that as soon as vaccine becomes available, we're going to get vaccinated. And that's going to be, we want to see 85% uptake in all age groups, including younger age groups. But then also, till such time that we have high level of, population immunity, we do need to observe all these practices irrespective of our age.
I would just add to that, this is a reminder for all of us, and we often talk about the risks and the risks being much higher to those folks that are elderly in our community versus those that are younger. But this is a reminder that the risk that COVID-19 presents is to all of us. A reminder and a reason for each of us to ensure that we are following the public health guidelines that are in place, in particular over the next number of weeks and couple of months. But also, a great reminder for all of us that when it is your turn, make your appointment and get the shot. Get vaccinated to protect not just yourself, but all of those around you.
We'll take our next question on the line. Operator?
We have Murray Mandrick with the Leader Post.
Good afternoon. You're asking people to keep in groups of 2 or 3, yet you're telling people over 50 to stay in the same bubble, which is going to include grandparents, parents of adult kids. You're allowing churches to accommodate 150 indoors, but you're not changing any outdoor gatherings where you say it's safer. Was there much thought put to the inconsistency and contradictory nature of today's decisions and the messaging? I guess I don't understand why you're asking people to do things that won't make much sense to them and that you really can't enforce anyway. And I guess I'd like the answer from the Premier, if at all possible.
Sure, I'd say that we're not asking people to do things that they're not uncomfortable with. Our message has been clear with respect to the measures that are in place. We trust the people of this province to make the best decisions with respect to ensuring that they are keeping not only themselves healthy and safe, but those around them as well. We're getting into an area now where we will see over the course of the next number of weeks a number of folks, elderly folks in our community, those that are part of phase 1, 70 years old and older. A number of them will be vaccinated. Day by day, a fewer number of them will not be vaccinated, as we understand that each and every day goes by, we have more people vaccinated than we did the day previous. As these days go along, we most certainly are going to have additional discussions as what we would expect. Our case numbers may stay the same, stabilize, or start to decrease. But most certainly, as we get those most vulnerable in our communities access to this vaccine, we do expect our hospitalizations and those severe outcomes to continue to decrease here in the province. And as they do, that preserves the capacity in our healthcare system, preserves the opportunity for us to have more discussions like we are today around softening some of the measures that are in place. Still having, still today, there are fairly restrictive measures in place. I think we would all agree that there are still fairly restrictive measures in place, in that you can only mix 3 households, and we're asking that they're the same 3 households and only up to a maximum of 10 people. But we are softening these measures as an understanding that we have another tool in our arsenal here today that we did not have at Christmas time, we did not have in the months gone by, and that is not only access to safe vaccines, and 3 different types of those now, but in the days and weeks ahead, access to a much larger number of those vaccines. And so this is a good day. This is a good day for Saskatchewan, and this is a day about a year out from when this when COVID-19 hit this province. This is a day now when we can look for more positive days in the weeks ahead.
Follow up, Murray?
So why not make those changes in a month from now or a month and a half when people over 50 are actually being vaccinated as opposed to us just talking about being vaccinated? And can you address that question specifically to Regina? As per the previous questions, we're dealing with this variant. We're dealing with numbers in Regina that are, I guess, unfairly high compared to other parts of the province. Why not, at least, if you weren't going to introduce policies, if you want to introduce these policies, why would you introduce the same policies in Regina, where it seems that we have a far more significant problem right now, particularly as it relates to the new variants?
Well, with respect to the household gatherings, which takes place immediately, there's still, as I said earlier, is a number of restrictions around those household gatherings, although they are being softened to some degree so that we can have some people do some visiting that they just have not done. We are asking them to continue to follow the public health orders that are in place. To your question about why would we not do this at a later date, the worship services will be effective on the 19th. That is giving all of our the facilities and the organizations that put on various types of worship services across this province some time to prepare. This is very similar to where they were last fall with respect to the guidelines and the measures that were in place. I was on the phone with many of our faith-based leaders on Friday and asked them to ensure that they do as good a job as they did in the summer into last fall, which the vast majority of our worship services were conducted in a safe manner, and we're asking them to ensure that they are conducted, in particular, over the course of the next number of weeks and into the summer, in as safe a manner as they possibly can on behalf of their congregation and all of those that attend. With respect to Regina and singling out Regina and treating Regina differently in the way of softening some of the restrictions, I said earlier we have a tool in our tool chest that we have not had available to us in the months gone by, and that is access to not only safe vaccines but a large number of vaccines. And that enables us to, as I said today, deploy the 3,500 vaccines that have been delivered to Regina right into the city of Regina here immediately, as well as the just over 15,000 additional AstraZeneca vaccines that we have received. We're able to deploy those in very short order through one of our drive-in clinics in the next number of days, as soon as we are able to deploy a very large number of vaccines, relative in particular to what we have had access to in the days gone, weeks, months gone by, to deploy those right into an area where we are seeing some variants of concerns being present in the community. That being said, Regina's numbers have continued to decrease over the course of the last couple of months, not maybe quite at the same rate as we've seen in other areas of the province, or Saskatoon, for instance, but overall they are down from where they were a month and 2 months ago. So the variants of concern are present in our communities. We're aware of that as we move forward. We appreciate the fact that we have our provincial lab that will be screening all of the test samples that we have, but this is also not unlike what we're seeing in other provinces as well, with respect to the variants of concern being present in most, if not all, other provinces across Canada. So we're watching them. We're deploying the tools that we have to our avail. For example, deploying these vaccines, these additional vaccines, right into the city of Regina in very short order, and most certainly are displaying our trust and our faith in the Saskatchewan people that they will make the very best decisions in behalf of the health and welfare of their family in the days, weeks, and months ahead. As I said, today is a good day for this province. Today is a step forward, and today is an opportunity for us to look for better and brighter days ahead, and it's been a long time since I've been able to say that.
We'll take another question in the room. Steph?
Mr. Premier, why not actually wait until people are vaccinated versus just their supply of vaccines? Why not wait until...
Well, some people are vaccinated today, a number of people, and what's exciting is there's more people vaccinated today than there was yesterday. There'll be more people vaccinated in a week than there is today, and as I said, we are going to receive well in excess of 100,000 vaccines by the end of the month. That is good for this province, and with our robust plan, we'll be able to provide those vaccines to Saskatchewan people in very short order on the prioritized basis that we have put forward, that we feel quite strongly and are seeing evidence in other areas of the world that it will decrease our severe outcomes of COVID-19. So with respect to the decisions that are being made today around households and then later this month on worship services, there's still many restrictions around both of those occurrences. I don't think if you compare to 13 or 14 months ago, you would ever believe that we would have the restrictions in place that we have had, and we've had them because they're effective and they work, but they are also effective and do work with the changes that we are making here today, and we're leaving in place the broader set of recommendations and guidelines that are stretched right across our communities for the time being. That being said, in the weeks ahead, to your question, we are going to be looking, as the vaccines become more available to Saskatchewan people, in particular, those elderly that have much more severe health outcomes. As those vaccines become available, we're going to look at softening additional restrictions in the days, weeks, and months ahead. Our goal is to get things back to normal in this province, but our goal is to do so and do so safely.
Follow up?
You both have said that household transmission has been the main driver of spread, so you didn't really answer my question, Mr. Premier. Why not wait until more people are vaccinated with the first dose? Because we only have 93,000 doses into people's arms today, but yet we're lifting a restriction that was in place because that's the main driver of spread. So why not wait until people are more vaccinated, even if it's the end of the month, before lifting the restriction?
We also, in fairness, have our lowest case count, our lowest 7-day rolling average in the last 4 months. We have a trajectory where our hospitalizations are down about 100 less than where they were at our peak. Our trajectories are in a positive direction, including the trajectory of the vaccine deliveries that we're receiving. We're, as I said, expecting more vaccines in the next 3 weeks than we've had in the last 3 months. This is a good day for Saskatchewan people. It's a good day for us to look forward to the next number of weeks, and this is an exciting time. And we've waited a long time to have something to look forward to, and I feel we finally are just turning that corner in the province. So we're making the changes that we are here today. We feel they're positive changes on behalf of the people that we represent across this province. And most certainly, we are putting our trust and our faith in the people of the province. They're going to have some personal decisions to make in the next number of days and weeks, and we trust that they'll make the appropriate ones.
To be fair, you still haven't answered. Why not just wait another month until more people are actually protected with the first dose versus hinging everything on a vaccine supply?
We're not hinging. Well, I think in fairness, the world is to some degree looking forward to additional access of vaccines. Us in Canada, and I've spoken to this many times, that we would have liked to have access to more vaccines at an earlier date. But we do have finally are turning the corner where we will have significant access in the next number of weeks. To answer your question, we're making these decisions here today. As we receive additional vaccines in the days ahead, we're going to continue to make decisions around removing additional restrictions that are in place so that we can start our march back to what we would consider a more normal society in the next number of months. This, as I said, this is an exciting day for our province.
We'll take our next question on the line. Operator?
We have Lara Fominov with 650 CKOM.
Hi. Last week, it was announced that there would be 112,000 Pfizer and Moderna vaccines delivered by the end of March, along with 15,500 AstraZeneca vaccines. Mr. Premier, you just announced during this news conference we'd be getting 124,000 more. So are you saying in the next 3 weeks we'll have more than 250,000 vaccines for the province? And how many people can we vaccinate per day?
No, what I'm saying, I believe, is we have about 95,000 thus far that we have delivered to the people of the province. We're going to receive about 124,000 over the course of the next number of weeks. So that would be a total then of about 220,000.
The Pfizer allocation has increased by about 20-30%.
And that includes the 15,000 AstraZeneca as well. So the total would be in the neighborhood of about 220,000, pardon me.
Follow up, Laura?
Yes, as well. Gatherings with churches led to at least one super spreader event with cases across the province. And so churches will be allowed to gather with restrictions in the coming days. Does this also include gatherings for funerals and weddings, which also can have religious services involved?
I think at this point all of that is being reviewed, And, I think we need to reemphasize that on the one hand, overall case numbers coming down, the undiagnosed infectives came down from around 20,000 to 5,000. The risk overall is low. The risk in many parts of Saskatchewan, South Rural Saskatoon, much lower than it's been for months. Certainly not that low in Regina. In fact, if anything, it's concerning right now in Regina. The far north coming down. And then, while we on the website have, cases by 32 geographies, obviously locally medical health officers look much closer. And what we see is even in the north and far north, we see sporadic outbreaks or clusters that may be in a very localized area or community. And so given all that context, I think we are in a better place right now, in terms of where we were even, a month and a half ago. But again, I would still emphasize that for people who are at higher risk, we use all options that you have to shield yourself from COVID till you're vaccinated. So for 50 and older, and all those options are available: takeout, curbside pickup, attending religious services virtually. I think when you go for a religious service, it's a structured event for an hour or so, but when there's a ceremony, it's slightly more different. The interactions are more different, so we'll have to look very closely at that as well. So all those options are going to be looked at very closely. And I think, it's been a long 12 months. While we didn't go into full lockdown, we did have some of the most significant restrictions in place since, 14 December. So I think on the one hand, it's some cautious relaxation was considered okay at this point, but it comes with all those caveats that, for those who are shielding themselves well, this is not the time to have your children coming for sleepovers and your children and grandchildren coming for sleepovers. In my opinion, this is not the time till you're vaccinated and 3 weeks out. And then cautiously think about how much you can expose yourself. But certainly till such time, when all of us are vaccinated with 1 dose and preferably 2 doses, we still can't think of relaxing many of our individual measures and broad general measures. But I think, within those limits, we all need to look at our individual risk and look at protecting those who are older, more vulnerable, and interpret some of these allowances in that way. And again, for virtual services, many virtual services throughout the year have promoted virtual attendance, and congregations have actually grown. But even if you're attending in person or choose to attend in person, again, following all those guidelines meticulously will be important. Super spreader events in almost all cases have happened, whether it's a bar or a place of worship or other setting, where there has been flagrant non-observance of all guidelines by the organizers and the attendees. And I think we also need to be very clear about that, at the end of the day, everything can't be inspected and legislated. But if you are in any setting where physical distancing is not being observed, where people are not thoughtful enough to be wearing a mask to protect you, even though you are not wearing you are wearing a mask, that is not somewhere you should be.
We'll take our next question in the room. Adam?
Can you explain what the guidelines or rules are within the bubble now? Because I know that there's some tips on, if you're over 50, you haven't been vaccinated, or kids in school, you work outside of the home. There's different caveats, but should I be wearing a mask? Should we not share food? What can you tell people about what to do, how to behave when they are with their bubble now?
So, like the people said, we've had this right from the beginning, right from March 2020, we had this up to 10 people, up to 2 to 3 households. And we never came below that till 15th of December. And that actually rule, for the most part, worked really well, because people, could assess their own risk, could assess the risk of the other household. And if, for example, there's 2 elderly couples who really are shielding themselves really well, and they want to, make a bubble, that could be an option. Again, I've said that if someone has, children and grandchildren who are working outside the house, who are attending school, have multiple contacts, I would not think it's a good idea to, have a lot of people in your house within that 10 limit. Overnight, for example, I think meeting and greeting outdoors is still important. Once you're vaccinated with at least 1 dose and 3 weeks out, looking at what the general case numbers are, what the situation is, I think that's a time to reconsider some of these things. But I think, generally people have understood how to protect themselves and have done really well over the year. And I think it's just revisiting some of those basic principles. But again, I would emphasize that even over the Christmas holidays, a lot of people did meet and greet outdoors. And now with spring coming, outdoors is still much better than indoors. And I think those basic principles have to tide us over. But this relaxation allows those instances where, 2 or 3 households can support each other more than they could have without, being non-compliant with the order. I think that's what the main allowance that this relaxation allows.
A couple of my colleagues have asked this already, but the timing of Easter coming up and what we've seen after holidays with bumps, Thanksgiving, Halloween, Christmas break, even maybe February break, what we're seeing now in Regina. What can you tell people about Easter and maybe why we didn't wait again until a little bit longer, even in Regina, to get more people vaccinated, or just loosening restrictions until after that break? Because that seems to be it's a problem we've seen in the past, right?
Yeah, so I don't think too much into the future, but, I did message earlier that Easter, school break over Easter, I think it's really important for us to stay the course, stick to our households, meet and greet each other outdoors, stay close to home. I would not recommend even interprovincial travel, not just because the variants of concern risk may be higher in other provinces, but because when you travel outside of your local area, you're less able to manage your surroundings and your exposure. But beyond that, certainly, if we look at the rate at which vaccines are coming, and if we all accept to get vaccinated, summer could be a very different time of the year. So again, I think, this is the last leg of our, very focused pandemic response in terms of high compliance with public health measures, and I think school break is an important time to be extra vigilant over those measures as well.
And I would just say, and this goes back to some of the comments I made in my opening comments, but when things happen with respect to a tool that we have not had available at any other holiday or at any other point in time is access to these vaccines. And by the Easter weekend, we will be vaccinating in that time period. We will be into our 60 to 69-year-old folks here in the province, which means that most, if not everyone above 70 years old, will have had access to have the opportunity to receive a vaccine if they so choose. So things are going to happen very quickly in the next number of weeks and next month or two with respect to the access that Saskatchewan folks are going to have to these vaccines. That being said, the announcements that are being made today, the households taking effect today, and the worship services on the 19th, this is a very cautious softening of some of the regulations that we have in place. There will be more that will be considered in the weeks ahead as we make these vaccines available to the people of Saskatchewan. But to Dr. Shahab's point, this cautious softening of the measures that we have in place should not be interpreted as a free-for-all, and it's time to just throw the thoughts of being safe and adhering to the public health guidelines that we have in place out the window. But most certainly at this point in time, it's increasingly important for us to continue to adhere to those public health guidelines. We do have variants of concern in this province, like many other provinces across the province. We do have, our numbers are on a trajectory down, but we still do have a number of COVID infections each and every day here in the province. But we also do have, and will have increasingly in the days ahead, access to these vaccines that are really changing our opportunity and giving us some view of the light at the end of the tunnel. And I would just once again, in addition to thanking Saskatchewan people for what they have done and continue to do in following the public health guidelines that are in place, I would ask them to seriously consider getting or making their appointment, and when it is their turn, getting their shot, getting vaccinated to protect all of those in our province.
We'll take our final question on the line. Operator?
We have Roberta Bell with Global.
Hi, my question is for the Premier, and I was just wondering in reflection, with the concerns about the government being slow to react to the pandemic and only bringing in measures once pressured, then compared to the people on the other side of it challenging, whether it's violating personal freedoms and if they're being restricted and wanting more justification for the measures. How have you sensed that you've responded to that and balanced these concerns?
Well, it's not for me to judge, my response or even the government of Saskatchewan's response. It's for me in my position and those others that I work with on a daily basis to listen to the advice that we receive from folks like Dr. Shahab, as well as others within our health system, as well as the general population in our communities across the province. And one thing that we have kept at the forefront throughout our response to the COVID-19 pandemic is we do trust and have faith in the people of this province to do the right thing, to ensure they are preserving the health of not only themselves but their family, their community, and those around them. And we have also never shied away from the fact right from the beginning that we're going to ensure that we will manage COVID-19. I think until everyone has access to the vaccine, their eradication is something that I just don't think is possible. But we will manage COVID-19 throughout, however long we're required to do so, to ensure that we can preserve the integrity of our healthcare system and to ensure that we can balance the spread of COVID-19 with the broader impact on Saskatchewan people. So we have done that. When you look at neighboring jurisdictions to the south, for example, much higher infection rates, much higher hospitalization rates in states that have a smaller population than Saskatchewan. But most certainly through having a little quicker access to vaccines than what we had here in Saskatchewan, they are seeing greatly decreased numbers in both their hospitalizations as well as their daily case counts. So we really feel that we are at a very important part or step in our response to COVID-19, and that is having now access to many more vaccines than we have had access to, and ensuring that we make them available on a very limited prioritization to ensure that we are keeping the people of this province safe in the weeks and months ahead, and getting our most vulnerable vaccinated as quickly as we possibly can. And I think we have a very robust plan in which we will be able to do that. And that's been shown in the early days as Saskatchewan is leading the nation with our vaccination plan in ensuring that we are getting those vaccines out into our communities and making them available to Saskatchewan people in a very, very rapid fashion.
Follow-up, Roberta?
So that being said, over the past year, is there anything in reflection or in retrospect that you might have wanted to do differently, including how small businesses are supported?
We did put a number of support packages together for not only small businesses but those in the tourism sector. I look back, Saskatchewan was the first province to put in place what we called a self-isolation program, which was essentially a sick pay or self-isolation pay for those that would ultimately have been in close contact. And so we have always worked throughout this pandemic with the federal government to ensure that Saskatchewan people have access to any federal funds that flowed through. I myself chaired our Council of Federation through the agreement for the Safe Restart across this nation with my colleagues, the premiers and the Prime Minister and then the Deputy Prime Minister. And we've also then augmented those programs with provincial funds and invested heavily in not only small business but invested in our communities, infrastructure in our communities through a $2 billion addition to our already $5.5 billion infrastructure plan. We provided $150 million to our municipalities through the Municipal Economic Enhancement Program, which we'll be talking about this week at the SARM convention, of course. But most certainly, if there was anything that I could do differently during this pandemic, it would have been far prior to the pandemic, and that would have been to be much more aggressive. However, we did ask at multiple occasions, but much more aggressive in procuring and setting up our domestic vaccine supply. That's something that is well underway now with the province stepping forward here a week or two ago, committing our funding should the federal government step into this place with Vito Intervac's becoming the center for pandemic research here in Canada. We'd ask again that the federal government consider that, and I'm confident that they ultimately will. so that if we are faced with additional variants next year, requirements for booster shots for COVID-19, we have not only the research capacity, but we also have the production capacity right here in Saskatchewan, right here in Canada, to supply Canadians with that booster shot if it would be needed. Also, in the years ahead, if we are to, face another pandemic, we most certainly would have, as I say, that research capacity, the production capacity to ensure that we can keep not only Saskatchewan folks safe sooner, quicker, but keep all of Canadians safe as well.
That concludes today's update. Thank you for joining us.